Good evening. This is Dr. Paul. Thank you very much for tuning to our channel today. This evening I want to talk a few minutes about generalized anxiety disorder. As always, visit us at www.drpaul.org. So let me talk about generalized anxiety disorder. Basically, these patients have anxiety for at least 6 months about events like work or school performance. But make no mistakes, when you diagnose this condition, you should always go by the DSM-4 criteria and just don't vaguely use anxiety, depression like that. These patients should have at least 3 of the 6 symptoms that I am going to tell you for at least 6 months. I mean, they may not have every day of the 6 months, but during that 6 months period, they should have these symptoms. Number 1, restlessness. The patient become restless about his daily activities. Number 2, he becomes easily fatigued. So the fatigueness is there. And number 3, there is difficulty concentration. The mind is going blank. Number 4, there is that irritability. Patient becomes irritable. Number 5, there is muscle tension. So patients get muscle tensions. Number 6, there is sleep disturbance. So those are the 6 symptoms, and the patients should have at least 3 of those 6 symptoms for at least over a period of 6 months. And then you diagnose this patient as generalized anxiety disorder. And make no mistake, always differentiate from other things. There is anxiety with repeated activities, that is obsessive compulsive disorder. There is anxiety being away from relatives or loved ones, that is separation anxiety disorder. If there is anxiety about weight gain, that is anorexia nervosa, and there are multiple physical complaints of the patient, that's a somatization disorder. So and also if there is a suspicion of a serious illness in this patient, that is hypochondriasis. So there is a big list of differential diagnoses, and you don't confuse those conditions with generalized anxiety disorder. The point is, those things are different, and generalized anxiety disorder is different. Now, these patients, they develop impairment in their social and occupational achievements, and because their anxiety and stress, it constantly cripples their basic daily functioning. Now, you should also think of drug dependence. Some of these patients, they get narcotics and benzodiazepines or withdrawals, and they get anxiety due to those medications. That is not generalized anxiety disorder. And similarly, there are medical conditions like hyperthyroidism that can cause anxiety, and that is not a generalized anxiety disorder. So always think of medical conditions and drugs and other psychiatric conditions that produce these problems. Now, generalized anxiety disorder is slightly more common in women, and it is usually chronic. Its usual onset is early adult life. And it also has familial aggregation. That means by generation to generation, the preponderance of the disease increases from parents to their offspring. So there is certainly that genetic component to this disease. Differential diagnosis, all comorbid conditions, and as I said before, all the conditions like somatization disorder and obsessive compulsive disorder and hypochondriasis and panic disorder. Some patient having anxiety about a panic attack, that's a panic disorder, and that's entirely different from generalized anxiety disorder. Patient having concerns and anxieties about weight gain, that is anorexia nervosa, has nothing to do with generalized anxiety disorder. So that differential diagnosis is important. Now, coming to the treatment. The management of generalized anxiety disorder is a long-standing treatment. Remember, this disease is a chronic disease. That's why you should always think about the long-term treatment. Just don't throw some Ativan, any other benzodiazepine on these patients and say just to get off your anxiety. That doesn't work. Benzodiazepines you can give to these patients for when the symptoms are very severe, just for weeks duration. But if you put them like 3 months, they are going to be hooked to benzodiazepines and develop that physiologic and psychological dependence over these medications. So there is nothing wrong with giving benzodiazepines, but you should not use them alone to treat generalized anxiety disorder. But you can use them as adjunct treatment when you are using other medications. And besides that point, actually, the psychotherapy and other medications, they actually proved quite effective to treat generalized anxiety disorder. So benzodiazepine should not be given to patients who have a personal history or strong first-degree family history of drug or alcohol abuse. So if the patient has that abusive potential or history or family history of abuse of narcotics or benzodiazepines, do not give them these medications, because they soon develop physiological and psychological dependence on these medications. Now, there are other medications like buspirone. Buspirone is a very nice medication, and it can actually give good results, because benzodiazepines can produce adverse effects like daytime sedation or ataxia. And especially if you give these to the elderly, and they can cause these ataxia and cause falls, and they get memory problems, and some of them develop that daytime somnolence and cause motor vehicle accidents. So when you use benzodiazepines, you should always tell the patient. Now buspirone it's a serotonin 1A receptor partial agonist, and it has many advantages. First of all, it produces no motor side effects. It does not produce memory impairment. It does not produce concentration problems, and it has no abuse potential, and it does not cause dependency or withdrawal even if you give this medication for long times. Now it also does not produce drug interactions, so it appears to be an almost ideal anxiolytic. So remember buspirone for generalized anxiety disorder. That's a very, very important question, and I am telling you that remember buspirone for generalized anxiety disorder is very important, but you should use it at least for 3 weeks to see that thing. So let me review the basic medications that should be used in generalized anxiety disorder. First of all, starting from benzodiazepines, then buspirone. These two I mentioned. There are other medications like tricyclic antidepressants. You can start with imipramine, and there is also heterocyclic antidepressant like venlafaxine. So these 4 medications you should remember. Okay, benzodiazepines, buspirone, and imipramine and venlafaxine, these medications. And there is a psychotherapy. There are 2 psychotherapies. Number 1, behavioral therapy, when you help a patient to identify and modify the pathological behaviors that are leading him to the anxiety. And the number 2 is cognitive behavioral therapy, and the patient will identify the specific conditions and the cognitive impairment that happens with those conditions. So he will identify those conditions, and then he will stop it. So that's about generalized anxiety disorder. Visit us at www.drpaul.org. Those of you who are taking USMLE clinical skills, I recommend USMLE Smasher for you. USMLE Smasher, it's a good book, and that's for the evening. Okay, thank you very much.